Dandruff occurs, essentially, when small bits of dry skin are shed from the scalp. You might spy these flakes in your hair or on your shoulders. Dandruff may make your scalp itchy, too. It's a common problem, but it isn't as simple as it seems. Dandruff is actually quite tricky to define because it overlaps with seborrheic dermatitis and other skin conditions that lead to a scaly scalp. Here's what you need to know. Signs and symptoms of dandruff. The big tip-off that an individual may have dandruff are the telltale patches of white flakes on the scalp, made up of dead skin, that come loose in your hair. And some other signs include, at times, the scalp can be itchy, greasy or dry scales on the scalp, yellowish to reddish scaly raised bumps along the hairline. Causes and risk factors of dandruff. Dandruff can happen for a number of reasons. Seborrheic dermatitis. If you have a particularly bad case of dandruff, it's likely a mild case of seborrheic dermatitis. SD is a chronic form of eczema that affects areas of the body that secrete the most sebum, or oil, notes the National Eczema Association. People with oily skin are often more prone to dandruff. The reason? A yeast called Malassezia globosa feeds on oils on the scalp. Some people's bodies perceive this breakdown of oil as an irritant, so the scalp reacts by upping the speed at which skin cells renew. For those without dandruff, it takes a whole month for new skin cells on the scalp to mature, die, and shed. But for those with dandruff, this process occurs in a mere 2 to 7 days. Contact dermatitis. Contact dermatitis is skin irritation caused by either an allergen or an irritant, resulting in an itchy, possibly painful rash. And in the case of dandruff, that reaction is on the scalp. This generally occurs because of hair care products or dyes, according to the American Academy of Dermatology Association. Dry skin. If cold winter air dries out your skin all over, including your scalp, then dry skin may be the cause of your dandruff. When dry skin causes dandruff, the flakes are usually smaller and less oily than the flakes caused by SD. Almost anyone can have dandruff, but the following factors can make you more susceptible. Shampooing habits. For those who are already at risk for dandruff, washing infrequently can worsen the condition. Taking extended breaks can lead to a buildup of oil that can lead to dandruff. Age. Dandruff often begins at puberty and peaks around age 20, becoming far less prevalent among folks over 50 years old. Weakened immune system. SD is more prevalent in individuals who've undergone an organ transplant and those with HIV or AIDS, hepatitis C, or alcoholic pancreatitis. For example, 30% to 83% of those with HIV report SD. Treatment and medication options for dandruff. Dandruff is an often chronic, but treatable, condition. Gentle over-the-counter shampoo to reduce oil and skin cell buildup. Wash hair daily with a gentle shampoo, lightly massaging the scalp to loosen flakes, per the Mayo Clinic. OTC dandruff shampoo. If gentle shampoo is not helping, try an over-the-counter, OTC, dandruff shampoo. It's best to alternate between 2 or 3 of these shampoos. For mild to moderate cases, look for dandruff shampoos that contain the following active ingredients. Tea tree oil shampoos or topicals that contain 5% tea tree oil, an antiseptic, antibiotic, and antifungal, appear to be a safe and effective treatment for dandruff. Increasing your intake of omega-3 fatty acids, like those found in salmon, tuna, and mackerel, will help regulate oil production on the skin.